Can you know about passive movement? Okay. What is passive movement?
Passive movement is the movement which is done by the therapist or physiotherapist or occupational therapist or rehabilitation center therapist.
Okay, very good. What is the principles of passive movement? Principles of passive movement.
So it is the stabilization of the patient and patient's position, and also the position of the therapist who gives the treatment.
Okay. Then indication of passive movement. Anyone?
The indications are for stroke patients, peripheral nerve injuries, spinal cord injuries, paralysis, etc.
Therapist position. Therapist position.
So the therapist position will be in walk standing position.
And also the comfortable position of the patient, comfortable position of the therapist where he or she can give treatment for the patient comfortably.
Okay. Define active movement. Active movement.
The patient can do himself without helping. This is called active movement.
Indication of active movement. Indication of active movement.
Muscle weakness and increasing ROM, range of motion. This.
Contraindication of active motion. Contraindication of active motion.
Fever, inflammation, open wound, etc.
Difference between passive movement and active movement.
The active movement is done by himself and the passive movement is done by someone else.
How it is suitable for active and passive in patient situation? Whether it is patient come from outpatient, which patient is suitable for a passive movement, which patient is suitable for active movement?
The patient with nerve injuries are suitable for the passive movements, and the patient with muscle weakness can do active movements, and for strengthening and increasing the range of motion can do for the active movement.
What are the criteria used for evaluation? Before that, active movement, passive movement. Before that, what are the criteria used for evaluation, assessment?
MMT to assist muscles and joint testing for doing active passive movements.
So explain MMT grade wise.
In grade 0 it's normal, relaxed position. In grade 1 flickering initial movement.
No, not normal.
Sir?
Normal. Normal meaning? Normal.
No contraction. Grade 1 means initial flickering movement. Grade 2 is eliminating gravity. Minimum risk against gravity and the minimum resistance and with full resistance.
Okay. So first outpatient department comes the patient. evaluate the MRC grading. MRC grading, patient grade 0. Okay, grade 0, no contractions. That kind of grading, which treatment is suitable? Grade 0 patient, which type of treatment is suitable?
Passive movements can be given to that patient.
Very good. So muscle power 0, so we'll go for passive movement. Okay, other treatment? Other treatment?
Mat activity is also given.
Okay. So okay. Then muscle power 1, which treatment?
Same passive movements can be given.
Then muscle?
PNF techniques can be used.
Pain of passive. Passive or active?
In passive.
Then muscle power 2.
Yeah, PNF techniques can be used in active. Stretching can be given. Relaxation
Passive or
techniques.
active? Passive stretching or active stretching?
It is if the patient can do active stretching, we can give active stretch, or we can do passive stretch.
In case of muscle power 2, is eliminated guiding movement, not perform active full range.
With the patient's ability, we can give the active or passive movements. We can
Stretching or definition?
to stretch the muscles,
Stretching muscle is elongation of muscle tissue.
lengthening the muscle
So,
tissues.
ஒரு பொசிஷனில் வந்து ஃபுல் மூமெண்ட் ரிகெயின் பண்ணால் தான் ஸ்ட்ரெச் ப்ராப்பராக ஆகும். ஸோ உங்களுக்கு மசில் பவர் 2ல் ஃபுல் மூமெண்ட் இருக்காது. இட்ஸ் எலிமினேட் மூமெண்ட் வந்து அகேன்ஸ்ட் லைன் மூமெண்ட் இருக்காது. ஸோ ஆக்டிவ் யூஸ் ஃபார் பேசிவ் ஸ்ட்ரெச்சிங். தென் சஸ்பென்ஷன் தெரப்பி. ஓகே. தென் mat activities. Then functional movement, functional re-education. Then we will progress to 3, muscle power 3.
Strengthening exercises can be given.
Free exercise. Muscle power 3 la free exercise. Okay. Then progress to muscle power 4. Muscle power 4.
By giving some resistance, we can increase the power of the muscle.
So progressive resisted exercise. Progressive resisted exercise. According to 3 principles. What are the principles? Progressive resisted exercise. 3 principles. Resisted exercise principle. Techniques.
Oxford, Skindals, Daniels and Worthlingham's.
Oxford, McCune, then DeLong. Okay. DeLong, McCune and Oxford. What are the difference between 3 techniques? So McCune is the same repetition, same resistance. Okay, progression is the same 10 repetition, constant of same weight. Okay, so for starting with 5 kg, same 5 kg, same repetition, not changing the weight and repetition. In D-LOM, first started slow to descending order. First will 1 kg with 10 repetition, then progress with the 2 kg, 3, 5 அப்படி. ஸோ அசெண்டிங் ஆர்டரில் நீங்கள் ப்ரோக்ரஸ் பண்ணி சேம் ரெப்பிடேஷன். ஓகே. இன் ஆக்ஸ்ஃபோர்ட் வித் டிசெண்டிங் சேம் 10 kg, then 8, 6, 5, 4 same repetition. These are 3 techniques, different. Okay. So what are the materials are used for rested exercise? in resisted exercise, what are the materials needed? Tumbles, then sandbag, then weight cuff curl, கையில் ஸ்ட்ராப் மாதிரி கட்டுவாங்க இல்லையா, then TheraBand, TheraTube, ஓகே, அப்புறம் ஸ்ப்ரிங், ஹேண்டுக்கு ஸ்ப்ரிங், டைனமோமீட்டர் இதெல்லாமே மெட்டீரியல்ஸ் ஃபார் ரெஸ்டட் எக்ஸசைஸ். ஓகே, ஸோ according to the MRC grading, 0 is for no movement, so prescribe for passive movement, passive stretching, then bed activities. Okay, then progress for muscle power 1, same passive movement, passive stretching, bed activities. Okay, then muscle power 2 with progress for active assisted exercise, then suspension therapy, then functional exercise, functional re-education. Okay, then we will progress for muscle power 4, we will go for progressive resisted exercise, same weight cuff, tumbles, TheraBand, TheraTube, these materials. Okay, any doubts?
Yes.
Thank you.